Getting things fixed, getting back to normal, and reopening the economy will require three key things: more testing to catch outbreaks before they get out of control, contact tracing to identify anyone an infected person came in contact with, and isolation to break the chain of transmission. Test, trace, isolate is the mantra. And it's the tracing part where the right to individual privacy collides with the need to protect public health. South Korea has led the world in successful contact tracing. As Jeff Semple explains, it's required some trade-offs not everyone is comfortable making.
South Korea offers a glimpse of a brighter future. Crowds returning to amusement parks, the movies, even the airport, as though the country just woke up from a strange dream. It feels great to be out with my family, he says. We are still cautious, but it looks like the containment efforts are going well. South Korea was one of the first and hardest hit countries by the COVID-19 pandemic. But after 2 months of strict social distancing, on Wednesday, it relaxed the rules. And since then, there have been almost no new cases.
The government had prepared. I think that's the most important thing.
Dr. Jerome Kim is the head of the International Vaccine Institute. He points to his country's outbreak of another coronavirus, MERS, in 2015, that spurred the government to introduce new emergency powers, allowing it to harness credit card records and smartphone GPS locations to track and retrace the movements of COVID-19 patients.
Although you're tracked, you're still anonymous. And it's really the government and the people who might have been exposed who find out.
The anonymized data is used to identify hotspots and in smartphone apps to alert users about cases nearby.
Really don't do well with this. Oops, so that's the alarm.
During our interview, Lee's own smartphone sounded an alarm, alerting him that a COVID-19 patient had visited his neighborhood bar, called King Club Zero, at a specific time.
And if you had a fever of 37.5 and weren't going to work and you knew that you'd been at King Club Zero, you'd go in for testing. And they probably would put you in isolation.
Similar apps have been deployed in more than 25 countries, from Australia to the UK. But what about Canada?
We're ready to go. We have a product that can be deployed in a matter of days.
Daniel Lee's Vancouver-based company pitched their contact tracing app to several provinces, including Ontario.
Unfortunately, we just didn't see the traction on the public sector side.
For the most part, Canada is still doing contact tracing the old-fashioned way.
Thank you very much. I appreciate that.
Health professionals and volunteers calling a COVID-19 patient's contacts one by one.
So that we can connect with them, find out if any of them are symptomatic and get them tested. Otherwise, they need to be isolating, and that's the instruction we provide to them.
But that system is far from perfect.
First, I got the call from the hospital telling me I got positive.
This Vancouver actor tested positive and says health officials asked him for a list of his contacts.
And then I told her what I've been doing, went to the gas station.
But an employee at that gas station told Global News they never received a call from public health and had no idea a COVID-19 patient had been there.
It's going to require many people to be able to follow up with all of those positive tests. And that's a part where I think we're particularly vulnerable because no public health unit has the resources to do that right now.
A contact tracing app would automate that process, but there's a catch. Most of the apps on offer require access to a smartphone's GPS location, allowing the government to track a person's movements and sparking concerns over privacy.
If you know that as of tomorrow, the government has a trace on everywhere I've been and all the people I've come in contact with, you may not want to live in a country like that.
For a contact tracing app to be effective, studies suggest at least 60% of the population needs to opt in.
If you have large swaths of Canada that look at these applications with suspicion, that look at these apps as injurious to their way of living, they will not use them.
But a solution may be in sight. Google and Apple are now building a framework that will allow contact tracing apps on their devices to use Bluetooth technology. The Bluetooth signal would locate other phones nearby that are running the same app. So say you'd visited a restaurant and the person at the table next to you were to test positive, you'd receive an alert. But your data would be encrypted and never leave your phone unless you tested positive and consented.
Apple has walked me through on 2 occasions all of what they've done in terms of the tech and the privacy preserving features and no geolocation data and everything. And so I can give my vote of confidence to it.
Download AB Trace together, turn on your Bluetooth, and make
Some apps, like the one released just last week in Alberta, already employ Bluetooth technology. But without software support from the tech giants, they've been plagued with problems.
Really, I think most serious app developers at the moment have to wait until Google and Apple implement their technical infrastructure in their smartphones.
The Google-Apple app support should be ready later this month, but most governments in Canada still have not authorized any apps to use the technology. Health experts warn the longer the wait, the greater the risk.
We tend to be very slow adopters of any new technology like that. We wait until the rest of the world has done it, and then we gingerly put our toes into the water. This could be a good opportunity for us to be a bit bolder. I mean, people, if they don't know by now, they should know that their location is being tracked on their phone 24/7, and most people have not turned off the location switch on their phone, and it's used for all sorts of things right now, typically for marketing. Hey, if it's used for marketing, using it for good to try to prevent deaths seems like a more noble cause, and so why wouldn't we be okay with that?
The more restrictions are lifted, the greater the need for contact tracing and testing. And experts warn Canada is currently lacking in both.